welcome back to another fresh episode of Osprey Observer TV, bringing you ever closer to your community. As always, joining me, Marie Gilmore, editor-in-chief of the Osprey Observer, and of course, another amazing guest for you today. Who are we talking to today, Marie?
So today we're talking to an excellent business in our community, LeHeal, and I wrote it all down because there's a lot of parts to this business. Biogenic stem cell therapy and regenerative medicine. They have locations in Lakewood Ranch, Tampa, Brandon, and Lakeland. And Stacy is here with us, the co-founder and COO. And this is sort of an area of medicine that we know is important. We know it does good work, but we don't necessarily know what they do. So we invited Stacy today. Welcome, Stacy. Tell us a little bit more about your business.
Sure, absolutely. LeHeal Biogenix, we focus on non-surgical approach to healing. And what does that mean? Our specialty is regenerative medicine. So for those of you that may not be familiar, regenerative medicine is about, it's the process of replacing and regenerating human cells to restore and establish their normal function. So essentially, your human body has the amazing ability to heal itself. Our body's made up of cells, and those cells then have created our organs, muscles, tissues, everything that we are today. And we have the ability through regenerative medicine to treat multiple conditions. And outside of that traditional known medical treatment of prescription medication or surgery.
And Stacy, how does a person get into this business? It's a very specific area of specialized medicine.
Yeah, absolutely. And, myself, the reason why I started getting involved in the business and started LeHeal Biogenix is because I believe in it. I'm a patient myself, and I had an injury to my left knee, and anyone that's had joint pain or injuries, tears, things of that nature, they understand it's really debilitating. For me, I was a runner, and running was more than just the physical activity. It was also the mental aspect to it as well. As a mother of two boys, I loved that I could be active with them. And when I had the injury to my knee, I was on the sidelines. I wasn't able to participate and do the things that I love. And after my procedure, 5 weeks later, I started running again. And within 6 months, I was doing all the activities at the gym again and was able to, really get back to what I love.
Amazing. So you come from it from an aspect where you have a personal testimony that this medicine does work, and you can help your patients to also get to that point of living life, right? That's what it's all about, getting back to living life. I'm a mom of 3 boys, so I know how important it is that we're active and energetic and have that energy for those boys. Absolutely.
Yes.
And your business has 4 locations?
Correct. Yeah, our main office is in South Tampa on Swan Avenue by Hyde Park. And then we have a satellite office in Brandon, Lakewood Ranch, and Lakeland.
So you're convenient for people who want to get that initial appointment, find out more about how you can help them. And then you've got your main office. And you were brought up on our radar to do an interview on My Osprey TV because you also have a very special program for veterans. And of course, being in Southeast Hillsborough County, we have a very strong population of our veteran community. So tell us about that program.
Yeah, well, it actually worked out really well. One of the laboratories that we work with for the tissue bank laboratories, we had worked with them with a collaboration, and they have a partnership with Brothers in Arms Foundation. We started to notice that we had a lot of veterans coming in our office, one of which is featured on our website, his story, his amazing story. And, after they put in those years of service, they put the wear and tear on their body. It's their knees, their back, their joints. And, now they've retired and they want to enjoy the rest of their life, or some of them are still active duty and, trying to continue to perform at the military, but also enjoy their home life as well. So we had the opportunity, they partnered with the Brother of Arms Foundation. And with that collaboration, the laboratory will actually sponsor the biologics for the procedures, and then we provide those procedures. So for those that are looking for alternative approach to, reduce the pain and kind of get their quality of life back, it provides a wonderful opportunity.
So
What a wonderful. Oh, sorry. Go ahead.
Marie.
Go ahead, Johnny.
So there's obviously still so much for us to learn, and I'm sure the technology is continuing to evolve on stem cells. And so in regards to, let's say, veterans who have, for lack of a better term, maybe historical issues of pain, and maybe certain injuries, is this something that can apply to older injuries as well as recent injuries?
Yeah, absolutely. The first step really is having the evaluation with one of our medical providers. So that way they can go through the medical history, review any diagnostics that have been completed for the patient, and do a physical exam. From there, then they'll provide realistic expectations on what the treatment options are. In addition to stem cell, we provide peptide therapy and laser therapy as well. Those treatment modalities really work synergistically to help to stimulate your body and that cellular activity on that repair and that recovery.
And so to that point, because again, as I'm sure for some people, just even the word stem cells may be controversial. Specifically with your labs, is it third party? Is it, am I using my own stem cells? How is that determined if it's both?
Yeah. So when it comes to the options with regenerative medicine, you do have the ability. There are options with practices to be able to use your own cells. Sometimes those cells are extracted through fat tissue, through bone marrow, or there's a basic procedure most people are familiar with, PRP, and that's where you're drawing your own blood and spinning that down and injected it into the affected area. Primarily what we utilize, and of course it comes to what the treatment options are, what the provider prescribes, and then really how aggressively the patients want to treat. They're part of that decision process. And, we utilize donor cells, and these are cells that come from the laboratory. They are from full-term healthy cesarean births. So it provides the ability to capitalize on very fresh cells to be able to help in that recovery. Essentially, they join your own cells and help to create that scaffolding and build that repair.
And I think for me, at least, maybe my final question would be, we hear it in many cases used as in the one you gave us of your own example, with knees or elbows or shoulders. I mean, there's a popular podcaster that I listen to who swears by it because he is into mixed martial arts and he's had many injuries and he just thinks the world of it. Is this in any way able to be applied to, or maybe is this something maybe still in experimental stages in regards to organs, right? Because we hear it about in terms of, tissues, again, like elbows, knees, shoulders, that sort of thing. But, is this something that can be applied to lungs or a heart, or is that still too kind of far down the road?
Yeah, the beauty about stem cells is they really do have the ability to proliferate and divide and essentially form into what you need and what's needed at that point, right? And so there's a lot of research out there. And of course, as you said, it's somewhat controversial, right? But if you start doing some research on, looking at the clinical studies that have been done, the use of stem cells is across the board, from aesthetic purposes to help with, repairing that tissue within the joint or replacing some of that, and it's gotten to the point now that some insurance is starting to cover it even for wound care. It hasn't evolved to coverage in other areas, but we've seen patients with outside of your normal, you think about it for joints and things of that nature. And, we've had tremendous results with patients with neuropathy. We've had patients that were seeking options for tinnitus, that's the ringing inside the ear. And, we really encourage them to do their own research on it as well. I'm very fortunate. My provider providers are kind of medical encyclopedias, let's say. They love providing that education and pointing it out to the patient. So, I think the opportunities are really endless. And, the industry itself, the practice of regenerative medicine will continue to grow and develop over time.
Well, Stacy, thank you so much for being with us today. I think there is a wealth of information that your company can provide. And that's why we love to do these interviews. Obviously, there's a lot more information out there. And thank you for your partnership with Brothers in Arms as well. I hope if any veterans or any members of the community want some more information, that they would contact you and maybe do a consultation, and you can really fill them in on options and opportunities available to them in our community. How can our listeners get a hold of you?
Yeah, absolutely. Our website is LeHeal.com. So that's LEHEAL.com. Our main phone number is 813-999-2192.
Well, thank you again for being here with us today, Stacy. There's a lot of information I know that we have to learn, but to me, it gives me hope that there are options out there for people. And to me, the more knowledge I have, the better I am to take care of myself, my family, and my family members. So thank you for what you do for our community. And we're so glad you have an office nearby.
Well, thank you for inviting me today.